Thanks for watching this week's video from NIVA Health. Today you're going to learn about knee pain. But before we do that, hit the subscribe button in the corner and then tap the bell so you can stay up to date every time we post a new video on our channel. Let me explain to you what we do here and why we do it. The first thing that we do is we understand how the body functions, and we want to support your body healing itself so that you can prolong the health of your joints. And I know we're talking about knees today, so let's be specific with the knees. But one of the options that we offer here is what we call amniotic fluid injections, right? And do you guys know what amniotic fluid injections are? Well, let me kind of break that down for you. So when a healthy baby is born, right? You got a healthy mom and a healthy baby. The baby is inside what we call an amniotic fluid sac, right? It's the placenta, which attaches to the umbilical cord. And so that fluid that's in there, that's the amniotic fluid. That actually, in actuality, it's actually the waste that comes from the baby. But in that waste, you have so much nutrition, so many growth factors, so many proteins, so many enzymes, so many healing factors that are antibacterial and anti-inflammatory. Wait, what did I just say? Anti-inflammatory. So if you have pain and inflammation and you're injecting amniotic fluid into your knee that's anti-inflammatory, how do you guys think that's going to feel? Right? Comment below and let me know if you've experienced amniotic fluid injections, and if you have, we want to know how you felt. But let me tell you that is a natural regenerative process. The other thing I can educate you on with amniotic fluid is it's actually, it goes through what we call an immunomodulatory response. Say that 3 times fast, right? It's a tongue twister. And basically what that means is that your immune system, it doesn't have the ability to react negatively, okay? So, a lot of people are like, well, what happens if you take this amniotic fluid and you put it in my body? Well, it's immunomodulatory, so it's not actually reacting with your body's immune system. So your body's not able to actually reject it, right? Which is a great thing. And that's why, we can use this FDA cleared product. And these are all made in CGMP facilities that are regulated by the Food and Drug Administration. And so, you're getting a clean product, and that's really the key. Safety first, right? Very important. So that's one option, and that will help eliminate the inflammation that patients are dealing with when they're coming in with pain, right? And a lot of times these procedures are actually covered by most insurances, which is really exciting too, because we've been waiting for this for a really long time. The next thing that we offer is, okay, so now we've taken away the inflammation, but you still don't have much of a joint space. So what do we do? Like it doesn't hurt as much, but you still have a little bit of a degenerated joint that doesn't have a joint space. So what we can do is we can actually inject what we call hyaluronic acid, HA for short, or viscosupplementation. And what it is it's kind of like a gel-like injection that goes in between your knee joint. And what that does is it creates a space. That space is kind of like a cushion. It's like, thank you, right? Create a little bit of a space. And then now you can walk, right, with more of a space. It's not like this or it hurts, right? And you can actually start to walk or ambulate a lot more comfortably with less pain. And you're actually, because of the space, you're obviously, because it's not rubbing together as much, it's causing less inflammation. So that's great that we're creating that space, but how do we actually support that? So another wonderful therapy that we offer is there's a specific type of knee brace that you can wear, okay, which will support your knee while you have that, after you've had the amniotic fluid, after you've had the hyaluronic acid where it's increased the space. You wear that brace to then start to stabilize, okay, the joint, so that your muscles can adapt to basically your new, knee. And so those 3 are absolutely wonderful. Now, another option that we offer, which is really like a higher level option, is in regenerative medicine, is stem cell therapy. So we can also add as a supplement to all these therapies actual cells that come from the placenta, that come from the umbilical cord, from the Wharton's jelly, that are mesenchymal stem cells. They come from the placental tissue, from the amniotic fluid. And it's a combination, it's a complex, again, it's an FDA cleared tissue and cells that we can inject into that knee, right? And help to actually, those are the very, very powerful growth factors, cytokines, all the good stuff that your body really needs to repair and regenerate the damage and the degeneration that's been there for so many years. So if you really want an impactful treatment, if you really want something that's gonna give you the highest chance to avoid that very dangerous knee surgery, that knee replacement surgery, where there's the statistics on knee surgery are pretty scary, and that's really like my passion and our team at NIVA Health's passion is to help people avoid surgery at all costs. I mean, if you can avoid going under the knife, if you can avoid anesthesia, the risk associated with it, the cost associated with it, a lot of times our procedures will actually cost you less than going through a knee replacement surgery, because the deductibles and everything are so out of control these days that you're better off coming here, because you're actually going to get a better level of care. It's going to cost you less, and you're going to get to keep your own knee. If you look up knee replacement surgery, or if any of you guys out there have had a knee replacement surgery, comment below, like, let me know how it went. Because I can tell you that it's not fun. I can tell you, there's one lady that I sat with once. She came in for a consultation. She had seven failed knee replacement surgeries. I mean, this poor woman, my heart was pouring out. I couldn't believe it, and she was still in pain. I mean, it's not fair. And so, obviously there's no guarantees with anything in medicine, but that's why you always want to start with the safest and most conservative thing first. Start there first and see if you can get a result. Okay, if you don't, then you can get a little bit more invasive. And so here at NIVA Health, we're going to be able to take you through this progression to give you all these options and to evaluate you and to work with you step by step every visit to make sure that you're seeing results and that you're happy with those results, and that you understand what's going on with your knee, and you understand what we're doing and how long it's going to take for you to start to feel better. That's just like really, really important for us to have total transparency, so you can totally understand what you're getting yourself into, and that's really the knee journey that we can offer you here at NIVA Health. So what I can tell you is that NIVA Health, we are national, and we're one of the fastest growing regenerative medicine, natural wellness, anti-aging practices across the country. But if we're not close enough to where you're located, I wanted to let you know that you should subscribe to this channel, because I'm going to be on here. Our team's going to be on here. We're going to bring in all of our medical board experts on here to talk about the latest and greatest advancements in healthcare, on what you can do. It's all about bringing information to you so that you can make the best decision for your health. Maybe you can educate your doctors out there and let them know that, hey, have you heard of amniotic fluid injections into my knees? I'd like to consider that. Ask your doctor about some of the things that we're doing. If they have questions, they can comment below. They can reach out to us and ask us, hey, can you share us a little bit about how you're treating knee pain, how you're treating back pain, how you're treating neuropathy. For us, our goal is to help the community. We want to help as many people as possible. So, make sure you subscribe below and hit the bell so that you can, get the latest updates from us. Okay, because we'll be coming out with a lot of info.